It was an unremarkable Monday morning in Chicago, the kind that begins with the quiet hum of the city waking up. For Madeline Ross, senior operations manager at one of the city's largest private hospital networks, it started like any other day. She arrived early, reviewed overnight reports, and prepared for the week ahead. Then came the unexpected email. Urgent meeting 9 a.m. No subject, no context. Inside the conference room, the air felt heavier than usual. No greetings, no small talk, just a single sheet of paper slid across the table. The words were cold, detached. Effective immediately, your position has been eliminated. No recognition of her 10 years of service, no mention of the hundreds of crises she had navigated. To them, she was just another name on an organizational chart. Replaceable. Forgettable. But what they didn't realize was that Madeline was the quiet architect behind the hospital's emergency protocols and its remote patient care systems, complex lifelines that no one else fully understood. Her departure wasn't simply a change in staffing. It was the first domino in a chain of failures that would soon reveal just how dangerous it is to underestimate the wrong person. Madeline Ross had never been the kind of person who sought the spotlight. 38, she had spent a full decade at HorizonCare Health, steadily moving up from a modest appointment coordinator to the unseen force behind the organization's most critical operations. She didn't wear her achievements like badges, nor did she linger in boardrooms to be praised. Instead, she preferred the quiet hum of control rooms, dashboards, and late-night calls, places where the work spoke for itself. Over the years, she became the guardian of systems most people at HorizonCare barely understood. She oversaw the emergency scheduling platform that could rearrange dozens of patient appointments within minutes when a doctor called in sick or when a sudden crisis struck. She managed the telehealth network that connected urban specialists to rural clinics, making sure a child in a farming town hundreds of miles away could receive the same level of care as a patient in downtown Chicago. And when servers glitched at 2 a.m., threatening to cut off life-saving consultations, she was the one who logged in from her kitchen table, often still in her robe, quietly restoring order before anyone else even knew there had been a problem. Her presence wasn't loud, but it was constant. She was the metronome, the heartbeat, the one who kept HorizonCare's operations steady no matter the chaos outside its walls. Doctors trusted her without question. Nurses called her before calling IT. Even executives, though they might forget to thank her, knew that when things ran smoothly, it was because Madeline had already handled what could have gone wrong. For her, the work was never about recognition. She wasn't driven by performance bonuses or plaques mounted in the lobby. What mattered was that every system she managed meant a patient somewhere would get help faster, that a nurse wouldn't lose precious minutes scrambling for resources, that a parent wouldn't have to drive 4 hours just to see a specialist. She carried that belief quietly, like an unspoken oath. In her mind, HorizonCare's success was measured in the moments it saved and the lives it touched, not in the quarterly reports or the glossy PR campaigns. And though no one at the top seemed to notice the full scope of her contribution, Madeline didn't mind. She knew the truth. Her role wasn't just part of HorizonCare's operation. It was the pulse that kept it alive. Jordan Hale arrived at HorizonCare Health like a fresh gust of wind. At least that's how the CEO introduced him. 29, he was the youngest executive the organization had ever appointed, carrying the title of Chief Patient Experience Officer. His resume sparkled with references to public initiatives, networking events, and his recent collaboration with the CEO on a high-profile community health project. It was clear from the start that his charm and connections had smoothed his path into the role. Jordan spoke fluently in the language of modern leadership. Phrases like digital transformation, patient-first innovation, and next-gen healthcare engagement rolled off his tongue with ease. He could light up a room with polished slides, full of color-coded graphs and aspirational slogans. But behind the confident posture, he had never navigated a real medical emergency, never managed a chaotic night when multiple systems failed at once, never felt the pressure of knowing a patient's survival depended on a process working flawlessly. The first department-wide meeting under his watch was held in the largest conference room, where the air was thick with anticipation. Staff leaned in, curious about what new ideas this young leader would bring. Madeline sat near the back, her notebook open, pen ready, not to critique, but to understand how he intended to change the flow she had worked years to perfect. Jordan's presentation began with sleek charts comparing HorizonCare's processes to industry innovators and global leaders in patient experience. But midway, his tone shifted. He described the current operational methods as outdated and misaligned with the demands of a fast-moving, patient-centric era. His gaze swept the room, resting just long enough on certain faces, people like Madeline, whose work formed the very backbone of those so-called outdated processes. He didn't name her directly, but the implication was clear. The ones who had been quietly running the systems were now obstacles to progress. He spoke of replacing old frameworks with agile AI-driven solutions, implying that the human expertise embedded in the current workflows was unnecessary. Some employees nodded politely, others exchanged uneasy glances. Madeline simply listened, her expression calm. What Jordan didn't know, and what Madeline had no intention of explaining in that moment, was that the emergency workflow scripts he was so quick to dismiss were hers. Not HorizonCare's. Hers. She had developed them in her own time, refined them through sleepless nights, and tested them under the most intense real-world pressures. Years ago, she had formalized her intellectual property rights, securing ownership in a contract that Jordan himself had signed upon assuming his role. It was buried in the onboarding paperwork, likely overlooked in his rush to step into the spotlight. Madeline didn't feel the sting of his words as much as the weight of understanding what they meant. Jordan's vision was built on the assumption that she and the safety net she had woven were expendable. But if he tried to dismantle the old systems without her, he would discover just how deeply his new empire relied on the very thing he had just called obsolete. The email from HR arrived late in the afternoon, its subject line reading simply, "Urgent meeting attendance required." Madeline had been in the middle of reviewing a scheduling irregularity for a rural telemedicine patient when the notification appeared. She didn't need to read the message twice to understand what was about to happen. After more than a decade at HorizonCare Health, she had seen enough urgent summonses to know they rarely brought good news for the person on the receiving end. The meeting was set for the top floor, in a small conference room with glass walls that offered no privacy, perfect for quiet but visible dismissals. Inside, Jordan sat at the head of the table, posture sharp and rehearsed. Beside him was Dana from Human Resources, her folder closed neatly in front of her. The mood was sterile, stripped of any human warmth. Dana began by reading from a prepared statement about organizational restructuring and realigning resources to better serve HorizonCare's long-term vision. Jordan took over, explaining that her role would be phased out and replaced by a contracted consulting group specializing in operational modernization. His words were smooth, almost theatrical, carefully chosen to leave no room for argument while avoiding anything that sounded like blame. Madeline listened without interrupting. She had no interest in defending herself to people who had already decided her future. Instead, she waited until the explanation ran its course, and then spoke in a voice that was calm, almost gentle. "I hope," she said, "you're ready for a week without an emergency system." There was a flicker, just for a second, in Jordan's expression. A tightening of the jaw, a faint shadow in his eyes. Dana looked momentarily confused, but neither of them asked for clarification. They probably thought she was exaggerating or worse, bluffing. She wasn't. The automated emergency workflow scripts, the ones that routed urgent calls, deployed telehealth specialists in minutes, and managed real-time patient transfers between facilities, were hers. Her intellectual property. Her servers. HorizonCare had access only because she had granted it, and that access ended the moment her employment did. She had structured it that way deliberately, after seeing how often the quiet architects of vital systems were pushed aside without acknowledgement. When the meeting ended, she stood, slipped her pen into her notebook, and placed her employee badge on the table. No dramatic pause, no parting speech. Just deliberate movements, controlled and unhurried. Back at her desk, she packed her things methodically. Her personal mug, the framed photo of her and her niece at the lake, the small plant she'd kept alive through countless overnight shifts. By the time she walked out of the building, the badge deactivated, HorizonCare's lifeline to its emergency infrastructure had already gone dark. She didn't look back. Not because she wasn't sentimental, but because she knew what was coming. In the silence that followed her departure, the first cracks in Jordan's vision were about to appear, and they would widen faster than he could imagine. Less than 24 hours after Madeline's departure, the first signs of strain began to show. What started as a few isolated complaints from staff quickly escalated into a system-wide emergency. The emergency scheduling platform, once seamless under Madeline's quiet supervision, froze without warning. Patients attempting to book urgent consultations found themselves locked out, the submit button grayed and unresponsive. At HorizonCare's surgical centers, operating rooms sat idle as cases were postponed. The delays weren't due to a lack of staff or equipment but because patient files weren't syncing between departments. A surgeon in Oak Park couldn't access critical allergy notes for a child scheduled for a life-saving procedure. A rural nurse in Peoria was locked out of telehealth charts, unable to confirm medication dosages for a patient whose condition was deteriorating by the hour. More than 40% of HorizonCare's remote medical workforce suddenly found themselves without access to the electronic health record system. They were logged out mid-session, unable to retrieve histories, diagnostic imaging, or even basic contact information. Each call to IT was met with the same strained response: "We're working on it." But the truth was, they were blind without Madeline's constant monitoring and behind-the-scenes interventions. Jordan, blindsided, moved quickly to find a scapegoat. In internal meetings, he pointed the finger at Madeline, hinting that she had deliberately sabotaged the systems out of spite. But when IT leadership reviewed the logs, the reality was indisputable. There was no breach, no malicious code, no destructive action taken. The outages were the result of unattended processes, small glitches that Madeline had been fixing quietly, sometimes at 2 a.m., before they could spiral. Without her, those small cracks had widened into chasms. The breaking point came when a middle-aged man with a severe cardiac condition was delayed in being admitted for surgery because his transfer paperwork was stuck in a digital queue. By the time the system finally processed the request, his condition had worsened dangerously. Though he survived, the near tragedy sent shockwaves through the medical staff. The local press caught wind almost immediately. A whistleblower from within the nursing staff leaked details to a health correspondent, framing the story not as a one-off mishap but as a systemic failure. Headlines began to appear online: HorizonCare emergency system crashes after key managers exit, and critical delays put patients at risk. As the story spread, patient families began posting their own accounts on social media, tagging HorizonCare with accusations of negligence. The damage was no longer contained within the walls of the hospital network. It was public, growing, and impossible to silence. And at the center of it all, though she had said nothing publicly, Madeline's absence was now a presence, felt in every missed appointment, every delayed procedure, every moment the system failed. HorizonCare had underestimated her value. Now they were paying the price. Jordan's fall from grace was swift and unceremonious. Within days of the system meltdown making headlines, the HorizonCare board called an emergency session, not to address the technical failures but to question the judgment that had put an untested executive in such a critical role. Reports from internal audits were damning. Jordan's lack of operational experience, combined with his public dismissal of the very processes that kept the network running, had left HorizonCare dangerously exposed. The board's patience evaporated after reviewing patient incident reports, including the near-fatal cardiac case. Jordan was placed on immediate suspension, his access to all systems revoked, and an interim manager with 15 years of field experience was brought in to contain the crisis. Behind closed doors, whispers circulated that his appointment had been less about skill and more about his personal rapport with the CEO, a rumor the board did not publicly confirm but did not need to. The optics spoke for themselves. The CEO, once confident in his choice, now found himself under direct scrutiny. Shareholder representatives demanded explanations for why a position so essential to patient safety had been handed to someone without a single emergency deployment under their belt. In a tense boardroom exchange, the CEO was forced to acknowledge that the appointment had bypassed the usual vetting process. For the first time in his tenure, his authority was openly challenged. While HorizonCare scrambled to salvage its reputation, Madeline's phone began ringing with offers. She had not reached out to anyone, yet word of her departure and the chaos that followed had spread quickly through professional networks. Among the inquiries was one from MedSync Solutions, a healthcare systems consultancy that had tried to recruit her years earlier. Back then, she had politely declined, choosing loyalty over opportunity. Now, the conversation was different. MedSync's offer was not just generous, it was deliberate in its respect for her autonomy. They proposed a consulting role with complete control over her schedule, double the compensation she had earned at HorizonCare, and full creative freedom to design operational systems without bureaucratic interference. The message was clear. They didn't just want her skills, they wanted her judgment. For Madeline, it wasn't about revenge or proving a point. It was about aligning her work with her values. HorizonCare had taught her an unintentional but vital lesson. No matter how indispensable you are, if leadership cannot recognize the worth of your contribution, they will treat it as replaceable. As she signed the agreement with MedSync, she thought of the nights spent quietly fixing glitches no one else understood, the emergencies resolved without fanfare, the lives impacted by systems that simply worked because she made them work. MedSync, those contributions would not be invisible, they would be the foundation of her role. HorizonCare, meanwhile, was left to rebuild under the shadow of its own short-sightedness. For those who had watched events unfold, the takeaway was as sharp as it was simple. In complex systems, true expertise is not loud or flashy, but losing it can be catastrophic. And for Madeline, the end of one chapter had already opened the door to something far more rewarding. Hoi ChatGPT,